Hey guys, Missy here. So I just wanted to go over an emergency kit for all these times that we are having right now. My emergency kit was completely a joke, so I just wanted to share with you what you really do need in order to take care of yourself if you need to leave your house or whatever you need to do. Okay? So make sure to hit the subscribe button and let me know that this is actually helping someone. And I will be posting more videos. And if you have any requests, just let me know. If you have any questions, I am here. Okay? I had been off YouTube for a while because I wanted to make sure that the videos that I made were accurate and worked for me, and I didn't want to give you guys any information that I wasn't 100% sure that worked for me. I'm not a doctor, I'm an advocate. I do things very different than other people, but I've been doing them for 11 years. I haven't had an infection in my feeding tube. I have a port, I've had a Hickman, I've had 6 PICC lines. I have gastroparesis, so I don't take anything by mouth. I do everything by feeding tube. So having an emergency feeding tube kit was really important. So when all this COVID stuff happened and I came to my mom's, I thought that this emergency kit would be there if I had an emergency. But apparently, the only thing that comes in here is a gravity bag. So that's a joke because we all know we need a lot of things to get this process going, okay? So the first thing that we need are gloves. Make sure that in your emergency kit you have enough gloves. I know they're hard to come by right now, but keep looking for them because you want to make sure that your hands are clean. Hand sanitizer is very important. Use it before and after gloves. Okay. So basically the only thing that it comes with is a gravity bag. And how a gravity bag works is you fill it up with water and you can hang it by a tack. And when you hang it, it looks like this, okay? Let me get my gloves on so I can show you the way that you should be doing it correctly, okay? This might be a little bit of a long video, but it's only because I want to make sure that you don't end up in the position that I'm in with a ridiculous emergency bag with just a bag in it, with no syringes, no alcohol preps, no, sponges or nothing. I mean, crusher, hand sanitizer, nothing. It literally comes with this. Okay? Now, I have a Mickey button feeding tube. If you have this type of feeding tube, you do not need an extension. It will hook up right to your tube, which you can see right here. Okay? So that's fine. I have a Mickey button feeding tube, so I need to have an extension set. So it depends, okay? You can, in an emergency, switch out your feeding tube, which is why I made sure to bring this, which you can find on Amazon. Quorum is a really good place to get supplies. That's where I get supplies. And on the last video, there is a phone number for Quorum if you want to get these supplies. And my insurance covers a lot of it, but your doctor has to order it, okay? So this is a feeding tube that a lot of people have, okay? This is fine. It's a fine feeding tube. I don't like it because I didn't want one that hung out of my stomach, and the Mickey button is for kids, and it just is flat against my stomach, which you can see in other videos. So this ridiculous thing, okay, you can hang on a tack. The higher you hang it, the faster it will go, all right? This comes with 2 bags. My emergency kit came with 2 bags, nothing else. But you can use one for formula, you can use one for hydration, and then you can rinse them out. You can rinse them out with dishwater or dish soap, and you can reuse them, okay? So just get a tack, get a nail, get a hook, whatever, and just put it up there, okay? That's the first step. The second step is to fill it up. The instructions here, which are also a complete joke, say not to fill it up all the way. So you can see there's 1,000 milliliters. So just fill it up to that. Don't fill it up any higher, okay? If you need 2 liters like I do, you are probably going to be on it for, I would say, 3 to 4 hours per bag, depending on how high you hang it. The higher you hang it, the faster it will go, okay? And there is a clamp right here on it, and the clamp moves up and down. So you can prime your set before you hook it up, which means that you slide this red part down, okay? That locks that into place, okay? Then you fill this up with formula or water. Then you can put this over a sink, over a cup, over whatever. Put the tip over it. You can unloosen the red part, okay? Now your line's open. Now the water or formula is going to flow. And as soon as it gets to the tip, you do this again. You roll that red part down. You lock it. You connect it to your feeding tube. You unlock it. You hang it. And that's how basically it works. So, but that's all it comes with. And we all know that you need a lot more things to take care of a feeding tube than a bag, okay? So make sure that you have some of these, all of these things that I'm going to mention, okay? So, first off, it says it comes with a 60 cc syringe. There was not a syringe in there. Make sure that you get a syringe and you put a few in an emergency kit. Okay, this is super important because it doesn't come with any at all. And if you want to add medicine or if you need to use your line for something else, this is obviously what you need. Now, another thing is if you need extra hydration, if you need, like I do, I have a major problem with hydration. I have to go in every week and get IV infusions to get my body to absorb water, okay? So what I do is I have this Triatol, okay? These are available on Amazon, and I'm not sponsored by it or anything. This is just what I've used for forever. And you put 1 in 1 liter in their hydration salts, and they will help you stay hydrated during this COVID crisis if you can't get to where you need to go, or if your supplies aren't getting to you or whatever. Order these on Amazon anyway. And I just keep 4 of them in my emergency pack, okay? Just to be safe. One thing really important, okay? This they call an oral dispenser. This is a 5 ml cc syringe. The difference is the tip. I don't want to open it because I might need it. But this is the tip, okay? And anyone who's changed a feeding tube knows. This controls the balloon water volume. As time goes by and you use your tube, the volume in the balloon will start to minimize. Everybody has their own number of cc's that works for them in their feeding tube, and you have to experiment and learn what yours is. Mine is 7 cc's. That's what I use. Personally, again, I'm not a doctor. This is just me saying what I need. get this. Because if you have an emergency and your feeding tube comes out because the water in your balloon is too loose, you are in a bad situation. You're going to have to go to the hospital and be around all these COVID patients when you're already sick. Other thing that's super important is get a whole box of gauze. Okay, get a whole box of gauze. You can get them from Coram. Again, the number is below the last video. So make sure that you have gauze, okay? The other thing, obviously, is you need to clean the area. Keep it clean. Get a box of alcohol preps, okay? And keep that in your emergency kit. Some people like to use betadine, iodine. That's fine too. This is really good if your feeding tube is irritated because it creates a film. But the most important thing is to follow 1 and 2. Maybe I have it upside down. I don't know. Could be the camera. So use 1 and then wait for it to dry. That's the most important because that makes the film. Then use part 2. Part 1 is the scrub and part 2 also helps with another film, and they both clean really, really well, okay? The other thing that I think is super important is bring some lube, sterile lubrication. Usually you can go to your doctor or have them mail it to you or have Coram mail it to you, but this helps when you are removing your feeding tube and putting in a new feeding tube. It makes it hurt a lot less. I'm going to be doing a video on that pretty soon, okay? One thing I want to mention. If you go to the hospital and your feeding tube is stuck, this is what they used on me. Okay? They grabbed my feeding tube, they shoved it inside, and with no pain medicine, and they shoved it inside as hard as they could with this surgical thing, and it was the most horrible thing. I mean, it was just terrible. Okay, so another thing that you're going to need, obviously, is a crusher, and make sure that you have at least 2 weeks worth of meds that you can talk to your doctor and say, look, I need to make an emergency kit. Can you send me 2 weeks or a month's worth of medication just to keep in that emergency kit? And then get a crusher. This is the best crusher. They have it on Amazon. And you can see, I use it all the time. You can see that it has like these grooves in it. And like the blue ones they give you at the hospital, they really suck. I have the Silent Night Crusher, which is the really big one that you've seen in other videos. But I would say, obviously, since they're really expensive and they're really bulky and big and heavy, that you should use this, okay? So make sure that you have a crusher. So let me make sure that I'm not missing anything because this is super important. This is something that could literally save your life. Oh yes, another thing that you should have is Tegaderm, or some kind of a covering for your feeding tube. Me personally, I go kind of against doctor's advice, against what normal people do, but it's worked for 11 years and I've never had an infection. I don't cover my feeding tube. When I cover my feeding tube, it gets really red and it gets really irritated and it hurts. And the only thing that really helps is the betadine because it has that film on it, but it's still red and hurts, and the stoma is like inflamed. The stoma is the hole that the feeding tube goes into. So hopefully later on in the next couple days, I will be doing a video on how to switch out your Mickey button feeding tube or a different feeding tube if you have problems during this emergency. I will be using, where are you, buddy? All right. So I'll be using this gastrostomy tube, okay? This is what I will be using. So I will be switching out my Mickey button with this. Then I will be putting my Mickey button back in because these are like hard times and I have one new Mickey button, but I'm waiting until mine really needs to be changed to do it. and continually checking how many cc's are in my balloon to make sure, because the longer you have it in there, the more that water is going to kind of dissipate, just kind of like leak out a little bit, which is understandable. You've got acid in there and things like that in your stomach. So I think that's it. If you have any questions, please give me a call. Make sure that you have gloves. Okay, so this is the list. Are you ready for the list? Because you need to get a pen and paper and get your doctors to prescribe this stuff to Coram Specialty Infusion, and you will be able to have all these supplies. And you can tell them, look, I need this, my emergency bag, I don't have one, or it doesn't come with anything, or whatever. So here's what you need, okay? You need gauze, you need alcohol or betadine. If you have a Mickey feeding tube, you need an extension set. If you have a gastrostomy tube, you do not need an extension set. The gravity bag will fit into your tube, okay? If you have a tube like this, okay? The other thing that you'll need is hand sanitizer, okay? You're going to need a really good crusher. You're going to need a month's worth of meds would be ideal. My doctor did it for me, and I think it's really understandable right now. You need to have a lot of gloves. Lots of gloves. They're hard to come by, but if you find them, stock up, okay? Because you're going to need them. You don't want to do any of this stuff without gloves. I mean, why? Why would you? Especially, even without the coronavirus. Why would you do this without gloves? It doesn't make sense. Use gloves. Use hand sanitizer before and after. Take them off and on. Other thing that you need is this 5 ml oral dispenser so that you can make sure that you have enough water in your balloon, okay? Other things that I recommend are the hydration salts that I've talked about. I just keep 4 in my emergency kit, and that's just fine with me. A few syringes, cc syringes, the like 60 cc's if that's what you want. Some people use 10. I like 60. Another thing that you can do is this extension set. I personally don't like because it's so skinny, and it's a right angle, which is kind of awkward. What I like is there is a couple different options, and one is a straight angle 8-inch or 12-inch, and it's a lot wider. So if you do get a prescription, you can tell Coram, hey, I want the wider feeding tube, whichever has the wider diameter, diameter and a straight angle instead of this right angle. They'll know what you're talking about, and you will get a lot easier, a lot less clogs, and your meds will go a lot faster. And if you're in a place where it's not safe, or you feel like, you have to do your meds, but I wish I wouldn't have to do them here, it's a lot faster because it's a bigger tube and less clogs. So I think I got everything. If you have any questions, just let me know. Please subscribe so I know that I'm helping someone. Be compassionate, loving to each other, and I'm out.